Bismillahirrahmanirrahim. Today we will talk about spinal cord. First of all, some gross features of spinal cord. It's long cylindrical part of central nervous system which occupies the upper two-thirds of vertebral column. It is enclosed in three layers which are protective layers. These are called meninges, as the whole brain is also covered in these three layers, that is dura mater, arachnoid mater and pia mater. There are 31 spinal nerves. Please compare it with the number of vertebra, which is 33. So there are 3 vertebra, but the spinal nerves are 31 in number. That is because for 4 coccygeal vertebra there is 1 spinal nerve, coccygeal nerve, and for 7 cervical vertebra there are 8 cervical nerves, one above the C1 and one below the C1. Above, the spinal cord is continuous with medulla oblongata through and it is connected through foramen magnum. Here there is medulla. In this picture you can also see this is brain stem, these are pons, medulla, and this is spinal cord, which is connected to the continuous with the medulla through this foramen, which is foramen magnum. The spinal cord starts from first cervical vertebra and it ends at the lower border or lower border of first lumbar vertebra. In adults and in young child, it may extend up to third lumbar vertebra. The difference between the length of vertebral column and spinal cord is due to the slow growth of spinal cord during fetal life. So there is a difference between the growth of vertebral column and spinal cord. That's why spinal cord ends at L1. The lower end of spinal cord, it tapers off, and here it is called conus medullaris. From conus medullaris, an extension of pia mater goes downward, and it gets attached to the tip of the it is attached to the coccyx. This is called phylum terminale. This red line, this is the extension of pia mater, which is called phylum terminale. And this dotted line shows the level of spinal cord in young children, and this green sac, it shows the subarachnoid space, which ends at second sacral vertebra. So the spinal cord ends at lower border of L1 in adults, and in children it may end at third lumbar vertebra. The subarachnoid space ends at second sacral vertebra, and phylum terminale, which is an extension of pia mater, it ends at coccyx. It is attached to the coccyx. Mm, as the this is conus medullaris, here the spinal cord ends, but there are nerves which are coming out and they run obliquely to come out from the sacral and lower lumbar intervertebral foramina, and these group of nerves here, they are called cauda equina. Spinal cord enlargements. The spinal cord is fusiformly enlarged in the cervical region and lumbosacral region. This is because of the muscle fibers innervated by these regions. The cervical region innervates muscles of upper limb, and lumbosacral region it innervates muscles of lower limb. So they are otherwise I have told you that it's cylindrical in shape, but in cervical and lumbosacral region it is fusiform, and this is because of the innervation of more muscle mass. So in the cervical region it is called cervical enlargement, and in lumbosacral region it is called lumbar enlargement. Now, as I have told you that the length of vertebra is more than the spinal segment, as spinal cord ends at lower border of L1. So this is the comparison. Um, the cervical vertebra, we have to add 1 to know the which spinal segment it is. For example, if at the level of C3, third cervical vertebra, we would add 1, that is C4, it would be C4 cord segment. In upper thoracic vertebra, we will be adding 2. For example, at T4, we will add 2 and it will be 6th thoracic cord segment. Then in the lower thoracic vertebra, for example, we will add 3. For example, at at T5 we will be having T8, 8th thoracic cord segment. Similarly, at T10 we have L1 and L2 cord segment. T11 we have L3 and L4 cord segment. At T12 we have L5, and at the L1 we have sacral and coccygeal segment. And at L1 is the lower level of spinal cord, where there is conus medullaris. Now the coverings of spinal cord. The coverings of spinal cords are similar to the coverings of brain. Um, there are 3 number. The outermost is dura mater, then we have arachnoid mater, and the third one is pia mater, which closely invests the spinal cord. Between arachnoid and pia mater there is subarachnoid space. Now there is a modification of pia mater that is called denticulate ligament. Here you can see there is a lateral extension of pia mater which is called denticulate ligament. The function of this denticulate ligament is to keep the spinal cord in the center of the vertebral column. The two things which are responsible for the position of spinal cord in the center of vertebral column is denticulate ligament and the attachment of filum terminale. Here you can see this blue is pia mater, and these are the lateral extensions of pia mater, which is called denticulate ligament. Now some detailed features of spinal cord. The core of spinal cord is formed by gray matter, and the outer area is called white matter. The gray matter contains cell bodies of neurons. The gray matter is present in the form of an H. This is anterior horn, and these are posterior horns. These anterior and posterior horns are connected to each other with the help of a commissure which is called gray commissure. This gray commissure is having a central canal in it. The part of gray commissure anterior to the central canal is called anterior horn of gray commissure, and the part of the gray commissure behind the central canal is called posterior horn of gray commissure. In some segments of spinal cord, there is another horn which is called lateral horn. This lateral horn contains cell bodies for the preganglionic fibers for sympathetic system. This lateral horn is present from T1 to L2. Then we have this white matter. Anteriorly, there is a fissure which is called anterior median fissure, and posteriorly, there is a sulcus which is called posterior median sulcus. There are two roots of spinal cord of a spinal nerve. There is anterior root which is also called motor root, and this is posterior root which is also called a sensory root. The posterior root has a ganglia which is called dorsal root ganglia or sensory ganglia. This motor and sensory root, they join to form spinal nerve. And after emerging through the intervertebral foramen, the spinal nerves divide into anterior ramus and posterior ramus. The anterior and posterior roots, they are attached to the respective segment of throughout the respective segment of spinal cord with the help of these small rootlets. Here you can see the anterior root which is motor root and posterior root which is sensory root. They join to form spinal nerve. This is anterior ramus and this is posterior ramus. Anterior ramus is attached to the sympathetic ganglia, which is the part of sympathetic chain present on each side of vertebral column. Now we will discuss in detail the gray matter and white matter of spinal cord. First of all, gray matter. In gray matter, we will discuss the anterior horn. The cell bodies, they are in the anterior horn, they are cell bodies of motor neurons, and there are some large neurons and some small neuronal cell bodies. They are divided into three groups: medial group, central group, and lateral group. First of all, medial group, it is almost present in the whole length of the spinal cord, and it supplies the muscles of neck, trunk, and abdomen. Then we have central group. The central group is only present in the cervical and lumbosacral region. In the cervical region, the neurons which are present, which supply the diaphragm. So the collection of these neurons, they are collectively called phrenic nucleus. Similarly, there are some neuronal cell bodies which supply the trapezius and sternocleidomastoid muscle. Their axons form the spinal part of accessory nerve, which is 11th cranial nerve. The neuronal cell bodies which are present in the lumbar region, their innervation is not clearly known. Then we have a lateral group. The lateral group is also present in the cervical and lumbosacral region. These cell bodies, they supply the muscles of limb. In the cervical region, they supply the muscles of upper limb, and in the lumbosacral region, they supply the muscles of lower limb. So in the anterior horn, we have got three cell groups: medial, central, and lateral. Then the nerve cell group in the posterior gray horn. There are four groups of nerve cells in the posterior gray horn. The first one is substantia gelatinosa. Substantia gelatinosa, it is present among these four groups in the posterior gray horn. Two are present throughout the length of the spinal cord, and two are present to the limited segments. So this substantia gelatinosa, it is present throughout the length of the spinal cord, and they carry sensations of touch, pain, and temperature. Then anterior to this substantia gelatinosa, we have nucleus proprius, which forms most of the part of the posterior gray horn, and they are concerned with the sense of position and movement, 2-point discrimination, and vibration. Sense of position and movement is also called sense of proprioception. Then anterior to this nucleus proprius there is nucleus dorsalis. Nucleus dorsalis is present from C8 to L4 cord segment, and they're also concerned with proprioception. This lateral to this nucleus dorsalis there is visceral afferent nucleus. It is present from T1 to L3. They carry a visceral afferent information or sensations. So there are four groups in the posterior gray horn: substantia gelatinosa, concerned with sense of touch, pain, and temperature; nucleus proprius and nucleus dorsalis, they are concerned with proprioception; and visceral afferent nuclei, which carry visceral afferent sensations. Then the lateral gray column or lateral gray horn. This lateral gray horn is present from T1 to L2, first thoracic segment to second lumbar segment, and in the sacral region from S2 to S4. This intermediolateral nucleus, they carry preganglionic fibers of sympathetic chain ganglia, and in the sacral region they carry preganglionic fibers for parasympathetic ganglia. So here the preganglionic fiber, they synapse with the neurons in the sympathetic chain ganglia on each side of the vertebral column. But in case of parasympathetic preganglionic fibers, as in the case of S2 to S4, the preganglionic fibers, they synapse with the cell bodies in the ganglia which are present near the viscera or in the wall of the viscera. The region which connect the anterior and posterior horns on each side, it's called gray commissure. In the center there is central canal, and anteriorly there is anterior gray commissure, and posteriorly there is posterior gray commissure or dorsal gray commissure. This central canal, this is lined by ependyma, which is ciliated columnar epithelium, and the central canal is continuous above with the cavity of fourth ventricle, and below it ends at conus medullaris, means where the spinal cord ends. This central canal also ends. So these are the summary of the nuclei which are present in the gray horn, gray matter of the spinal cord, and in the anterior horn there are lateral motor neuron group, central group, and medial motor neuron group. And in the posterior horn there is substantia gelatinosa, nucleus proprius, nucleus dorsalis, and here visceral afferent nuclei. And in the intermediate horn there is intermediolateral nucleus which is carrying the preganglionic fibers for sympathetic ganglia. Now we will discuss white matter. For our convenience, we just divide the white matter into three parts. Between anterior median fissure to emergence of anterior root, there is anterior column. Between emergence of anterior root and entrance of posterior root, this is lateral column. And between entrance of this posterior root and midline, there is posterior white column. So anterior, lateral, and posterior white column, or they're also called funiculi. As we know, the gray matter, in the gray matter there are cell bodies, and in the white matter there are nerve fibers. The nerve fibers are when they enter the spinal cord, they collectively form tracts, bundles. They are arranged in the form of bundles. These bundles are called tracts. There are some ascending tracts which carry information from spinal cord to the supraspinal levels, and there are some descending tracts which carry information from brain or brainstem to the spinal cord. On this side, I'm showing you ascending tracts, and on this side there are some descending tracts. The ascending tracts, there is fasciculus gracilis, fasciculus cuneatus, and dorsal and ventral spinocerebellar tracts. Spinocerebellar means they carry information from spinal cord to the cerebellum. There are anterior and posterior, or you can say ventral and dorsal spinocerebellar tracts. And there are lateral spinothalamic tracts and ventral spinothalamic. So anterior and lateral spinothalamic tract, and anterior and posterior spinocerebellar tract, and dorsal and fasciculus gracilis and fasciculus cuneatus. These are ascending tracts. On this side, in the red, I have shown you descending tracts. So first, this is lateral reticulospinal tract, this is lateral corticospinal tract, this is rubrospinal, this is medial reticulospinal, and this is ventral corticospinal tract, and this is vestibulospinal tract, and this is tectospinal tract. We will discuss the details of these tracts in a separate lecture, inshallah. This table is very important. There is a comparison between different parts of the spinal cord, between cervical, thoracic, lumbar, and sacral region. First of all, the shape. As I have told you that the cervical and lumbar region is fusiformly enlarged because they innovate more muscle mass, so they are oval in shape. And the thoracic and sacral region, they are in the spinal cord is rounded. Then in the case of white matter, fasciculus cuneatus and gracilis is present in cervical and thoracic region, but cuneatus is absent in lumbar and sacral region. Then in the interior gray matter, as we have read that the medial group is present almost throughout the length of the spinal cord, and the central group is present in the cervical region and lumbosacral region, and the lateral region is present, lateral nucleus is present in the cervical and lumbosacral region. Then the posterior gray matter, substantia gelatinosa and proprius is present throughout the length, and they are but the dorsalis is absent in the cervical region. Similarly, the lateral gray matter or lateral gray horn, it is present in the thoracic region, and L1 and L2 in the lumbar region, and then S2 and S3 and S4 in the sacral region. This is again the difference between different parts of the spinal cord. Here you can see the lateral horn, which is present in thoracic region for preganglionic sympathetic fibers. Now these are the names of ascending and descending tracts. They are lateral spinothalamic and anterior, and posterior and anterior spinocerebellar, cuneocerebellar, spinotactal, spinoreticular, and fasciculus cuneatus and gracilis. There are some descending tract, pyramidal tracts which reach the conscious level. These are anterior corticospinal and lateral corticospinal, and some extra pyramidal tracts. We will discuss these all these tracts in detail in a separate lecture. Spinal tap or lumbar puncture. It is used to give spinal anesthesia. It is used for some therapeutic and diagnostic purposes. So we should know the surface markings where to do the spinal tap. We draw a line between the highest points of the iliac crest. This line passes through uh, uh, the spine of L4. fourth lumbar vertebra. Here, here, the between highest points of the iliac crest, here the fourth spine of the fourth lumbar vertebra. So we insert a needle we insert a needle on the upper and lower border of the fourth lumbar vertebra. As we know that the spinal cord in adults it ends at the lower border of the L1, and in children it ends at the third lumbar vertebra. So it is safe to pass the needle above and or below the fourth lumbar vertebra. Now these are the structure that are pierced by spinal tap needle. First of all, skin and fascia, then supraspinous ligament, then interspinous ligament, then ligamentum flavum, and this is epidural space, means outside the dura. It is filled with fibrofatty tissue. Then this is dura, and this is arachnoid matter. That's it. Thank you so much.